And Ms. Wright, you may begin.
Thank you, Letitia. I appreciate it very much. Hi, everyone. This is Carol Wright, and I'm your moderator for the day. I'm co-director of the National Aging and Disability Transportation Center, and I serve as Assistant Vice President of Mobility and Transportation for Easter Seals, located here in Washington, D.C. We have this webinar closed captioned for you, and if you need to access the closed captioning, click on the CC icon, hit Control and F8. This webinar is being recorded, and it's going to be archived on our NADTC website. The PowerPoint was emailed to registered participants and will be available for download with the archive. If you're connected by phone and the internet, please mute your computer speakers. I want to tell you just a little bit about the NADTC. It's a partnership of the National Association of Area Agencies on Aging, which we call N4A, and Easter Seals. And it builds upon the work of the National Center on Senior Transportation and Easter Seals Project Action. What the center is designed to do is to promote the availability and accessibility of transportation options that serve older adults, people with disabilities, and their caregivers. And especially as we discussed today's webinar, it has a focus specifically on the Section 5310 formula grant. The goals of the NADTC, well, certainly it's to promote the use of accessible public transportation anywhere that people want to go, whether it's for employment, healthcare, education, just to socialize or to support people being able to live independent lives. We want to also make sure that we increase the effectiveness, efficiency, and quality of coordinated human service transportation, and to ensure that transportation planning is done in conjunction with broader planning activities at all levels. We want to highlight and assist in developing promising practices to solve transportation challenges, maximizing the effectiveness of federal investments in specialized transportation. And so we want to share with you best practices that are out there that can be replicated across all parts of the country. Our target audiences are transportation professionals, human services providers, AAAs, people with disabilities, older adults, veterans, caregivers, certainly communities and individuals with limited resources, state DOTs, MPOs, and other government organizations. So what is it that the NADTC does? We try to find ways to reach out to all of you and touch you in whatever ways you like to learn the best or wherever you get your information. So we have our website, we have a blog, we participate on Facebook, we just started our YouTube channel, we have a Twitter account, we do email updates, including e-alerts that come out to tell you not only things that we're doing, but what's happening in transportation all across the country. We will be doing a yearly trends report that will let you know what's happening in accessible transportation, and there will be a technology-focused white paper and lots of technology resources that are made available to you. We provide person-centered technical assistance, and what that means is that we want you to get to a real live person to talk to. So we have an 800 number. It's actually 866, and it's an information and referral hotline. The number's on your screen. It's 866-983-3222. When you call that number, you will come to a recorded section that asks you who you are in terms of what type of agency you represent, or if you're an individual, and what kind of question you have. Once you pick a selection, you will go directly to an actual human being that you get to talk to, and we think that's really important. We also offer an information clearinghouse, so we have all kinds of new resources, but we also have the resources that were part of our earlier websites for the National Center on Senior Transportation and Easter Seals Project Action. So if you depend on those resources in the past and you've wanted to have those available to you, they are still there for you. We'll have new online publications that you can download, and all of our resources are always free. And we have a partnership with the Elder Care Locator. If you're unfamiliar with it, there is a button on our website that you can actually just click, and it will connect you with the Elder Care Locator, and they will help you find transportation options anywhere you are, anywhere in the United States. We also offer training, webinars like this one, an online course that some of you are already registered for, the Section 5310 online course that is part of this webinar series, and in-person events where we present on topics at area conferences and especially national conferences. We also have coordination and partnerships. We have stakeholder review committees for the various things that we're working on. We have open dialogues that we sponsor, and we have forums, and you'll see those forums on our website as well, and there will be a forum as part of our online course. We want to also invest in community solutions, and we have a community grant program coming up. Watch for this on our website. You should see something next month, and the website's given there for you, www.NADTC.org, and there will be 6 communities that will be funding through a grant program. So if you're interested in that, make sure that you're checking our website. If you want to stay up to date with the National Center, make sure that you sign up for our e-blasts. Again, you can do that on our website. You can visit our website just to see what information is there. Keep up with our blogs. Become one of our Twitter followers. Watch for us at the national conferences. Call and use our hotline if you have a question, or take our online courses and participate in webinars like the one you're in today. We want to also make you aware of other resources that are available to you. The FTA, the Federal Transit Administration, funds 3 technical assistance centers. The one I've just told you about, as well as the National Rural Transit Assistance Program. Most of you know that as National RTAP. And then we have a third one, the National Center for Mobility Management, which is NCMM. NCMM is a partnership between 3 national organizations, Easter Seals being one of them, and we partner with the American Public Transportation Association, APTA, and the Community Transportation Association of America, CTAA. So, welcome to our first Section 5310 webinar. We're excited to introduce you to Danielle Nelson from the Federal Transit Administration. She's responsible for oversight of the Section 5310 program, and she serves as the Rise to Wellness Program Manager. She's providing the federal perspective today, maximizing the effectiveness of the Section 5310 program.
All right. Thank you, Carol.
Okay, and we're happy to have her. And she is a part of this first webinar from the federal perspective, but there's a series of webinars we'll be doing on Section 5310. The second webinar is next Thursday on July 7th. It will be at the same time from 2 to 3:30 Eastern Time. And we will have the State DOT perspective featuring Chris Dudley and Kari Banta from TxDOT. You can sign up for that webinar on our NADTC website, and it's listed there for you. The third webinar is going to be from the local perspective. The date is yet to be determined. It should be in August sometime. We may actually have 2 of these, and there will be examples of successful, innovative uses of Section 5310 funds. And as always, we like to give you examples of things that you can replicate, and you can use their good ideas to use in your own communities. So watch our website or sign up for NADTC e-alerts for announcements of additional webinars. And today, if you have not signed up yet for the online course on Section 5310, you can still do so after this webinar. The course is free. The registration is open until July 15th. It's self-paced, and you'll have until September 30th to complete the course. There will be an online forum and lots of additional resources that are open to people who are taking the class. So with that, I will introduce you to Danielle and let her tell you the federal perspective as it pertains to Section 5310.
All right. Thank you, Carol, and welcome everyone to the webinar today. I'm going to make this quick and painless. I'm going to talk quickly about the purpose and the history of the Section 5310 program, some partnering and planning, as well as eligible activities and projects, who is eligible to apply, and lastly, how to apply. And while I'm going through these, I'm going to share with you some innovative projects and communities and what they're doing at the local and state level. So the goal of today's webinar is I hope that whether you're a current subgrantee or a future subgrantee, that you will have great ideas on how to partner, design, select, and operate very innovative and effective 5310 projects in the future. So with that, we will jump right in. The Section 5310 program is the Enhanced Mobility for Seniors and People with Disabilities. This is a flexible state-managed program, and the goal is to connect seniors, those 65 and older, and individuals with disabilities with their communities. And so here are 3 quotes from 5310 funded program riders. So what it means to these individuals is independence, inclusion, and access to health and wellness. So this is really what the program is all about. It's getting people to their healthcare appointments, getting people out and about. So I just wanted to share these with you. And the purpose of the 5310 program is really to improve the mobility of seniors and individuals with disabilities throughout the country and remove barriers to transportation for those people that are transportation disadvantaged. So the program history, to really understand the program today, it's helpful to take a quick look back. So the program was started in 1975, and it started as a discretionary capital assistance program. And the grantees were private nonprofits, and it really was a gap-filling program for human service agencies. And then with the next legislation, IHT in 1991, there were some changes made. So it encouraged coordination among human service providers. It made acquisition of service eligible, and that still today exists, and it's specific to the 5310 program only. And then also it added the ability to flex highway funds to 5310 programs, including this 5310 program. So moving on, we got to Safety Lou in 2005. This is when the coordinated plan requirement was established. Those locally developed coordinated plans used for 5310. As most of you probably are aware, it still is required today for 5310. Unfortunately, it's no longer required for the other FTA programs, but still going strong for 5310. And then came the MAP 21 in 2012, and this is where things got a little interesting for this Section 5310 program, because it took the former New Freedom program, the Section 5317 program, and married it together into 5310. And so this is when the apportionment came into the program, where it took 60% of the funding goes to urbanized areas, and then 20% to small urbanized areas, and 20% to rural. It also made operating expenses eligible, and it expanded the coordinated plan requirements to calling out specific stakeholders that must be involved. And then continuing, just to reiterate the changes under MAP 21, so a large urbanized area is a community that is over 200,000 in population. So now they get 60% of 5310 funding to those areas. 20% of the funds go to communities, small urbanized areas that between 50,000 and 199,000, and then 20% of it goes to rural areas, those areas under 50,000. And if you want to see the apportionment table, the link is there. It'll take you to see what your community, if you're unsure if it's small urban or urban, you can see where it classifies and how much your community receives. And then so changes under MAP 21, because this is a really important slide because in MAP 21, when New Freedom was rolled into the 5310 program, we started to bucket things out, traditional or any programs that were previous 5310 programs before the changes in MAP 21. Other are those that were formerly New Freedom programs. So those things that were formerly under New Freedom are now considered other or non-traditional under 5310. So that's really where these categories came into play, was in the changes in MAP 21. And so going forward, you're going to hear me say traditional and other projects, and this is why, was that change. So now our current legislation is the FAST Act. It was passed December 4th of 2015. And so 3 important changes that have come about is that now eligible as a recipient are state or local government entities that operate a public transportation service. So let me give you an example. Since we're here in DC, I'll give you an example from DC. So because DC is an urbanized area, the designated recipient was formerly DDOT, or the DC Department of Transportation. It's now the WashCog, the Council of Government. And so formally, before the FAST Act, WMATA, which is, they run the metro, it's the Section 5307, the urbanized transportation provider in the area, they had to come as a subrecipient to the designated recipient, WashCog. But now with the FAST Act, if they wanted to, they are eligible to come in directly. So that's really what this change means. Another change in the FAST Act is that we now are required to collect best practices, and we're very excited about the new NADTC as they will be helping us with this. And then lastly, we have a new discretionary pilot program. So right now, the 2016 funding, you can see that line, we had $2 million for the pilot program. We also added additional research funds to that pot. Those programs, the projects were already submitted, they're under review, they'll be awarded later this summer. But if you did not apply, or you would like to apply those 4 more years of funding, so we'll be putting out $3 million, potentially more again if FTA sweetens the pot and makes it larger for next year. So stay tuned for that. So who receives the funds? It's who are the recipients? So it's a state-run program, so the funds FTA gives them or portions them in rural areas, in small urbanized areas, it goes directly to the state DOT. So it's quite simple in those cases. Where it gets a little tricky is the large urbanized areas. So how it works is your state governor designates a designated recipient for those large urbanized areas. And it stays the same until the governor submits a new letter changing that designation. And then also, as I mentioned through the FAST Act, recipients can also be local or state entities providing public transportation service. So what is the role of this recipient? Once they receive these funds, they're required, again, if it's a small urban or rural area, it's a state DOT, and they have to have a state management plan. If it's an urbanized area, that designated recipient must have a program management plan. So that's the difference between the SMP and the PMP. So for the state, they're going to have this SMP that includes all the information about how they're managing the 5310 and the 5311 program, which is the rural area program. And many subrecipients in, for example, rural areas are likely receiving 5310 and 5311 funds as a subrecipient. Also, recipients' role is to plan for future transportation needs, gain feedback from the community, notify eligible entities of the available funding as subrecipients. They also have to submit an annual, so each year, a program of projects to us at FTA, so we can see how they're spending their funds and what the projects are. So the project selection process. So again, it's a state-run, very flexible program. So they have the option, the process for selecting projects can be formula-based, it can be competitive, or it can be discretionary. And how you find out how your state runs this is through, again, that state management plan where it's outlined how they'll do it, or if you're in an urbanized area, it'll be in that program management plan. So whatever the selection process is that your state has chosen, it has to be equitable among the eligible groups, and the projects have to be selected, they have to be included in that coordinated plan that, again, is required for this program. And then it has to, the coordinated plan must have been developed and approved. And the reason why these words are highlighted is because it's in the law that they must be developed and approved by a group of stakeholders, so older adults, persons with disabilities, etc. So let me just give you a quick example. I know you guys are going to hear from the Texas DOT on the next webinar, but I thought I would quickly give you an example of how Texas, their DOT, emphasizes local public involvement in the selection of their Section 5310 programs. So they have stakeholder involvement early in the process, both in planning, decision-making, and then the implementation of the projects. So they have districts where they have stakeholder groups that are put together of no more than 15 members, and then those stakeholders include community neighborhood leaders and groups, traditionally underrepresented groups, human service and workforce agencies, etc. And the aim is that this group of stakeholders is able to have a say and help in the selection process. And the next slide continues on and just shares that in recommending the projects, these stakeholder groups are asked to consider these 6 objectives. That's just to share that with you. So subrecipients. So for those traditional projects, so those that were formally under 5310 before the MAP 21 changes, the subrecipients are private nonprofit organizations, and then it can be a state and local government if, and only if, approved by a state to coordinate services for seniors and people with disabilities, or certifies that there are no nonprofits available to provide the service. And one thing that I should note is that it's required that at least 55%, so that's the floor, not the ceiling, of 5310 funds are spent on traditional projects. And then, so subrecipients in the other category, so again, those that were formerly New Freedom, Section 5317, before it was rolled into the 5310 program, those eligible subrecipients are state and local governments, private nonprofits, and operators of public transit. So traditional projects. Again, this is just to share with you that 55% requirement, and these are for capital public transportation projects, those that are designed and carried out to meet the needs of the target population when public transit is insufficient, inappropriate, or not available. So here are some examples of traditional projects. You know, it's buying buses, buying vans, mobility management programs, computer hardware, and also contracted services. So at the bottom there, contracted services can also be called acquisition of services, but it's the purchasing, and it's only specific to 5310. So you can contract for services as capital under an 80-20 match, even though it's operating included. So that's very specific to this program. All right, so other projects. So other projects under the 5310 program are those that were formerly New Freedom. So it's including public transportation projects that exceed the requirements of the ADA, projects to improve access to fixed route services, and then alternatives to public transit that assist the target population. And then so here are the public transportation projects that exceed the ADA requirements, some examples. So it could be expansion of the paratransit service beyond the 3/4 of a mile requirement. It could be the cost of providing same-day service or door-to-door service, also including mobility management programs to supplement paratransit. So, and these are projects to improve access to fixed route and then decrease reliance of paratransit. So for example, travel training. If you help to teach older adults, for example, to use the fixed route service, that's a great way to reduce the reliance of paratransit. And these others are examples of projects. So here are some additional examples of other projects: mobility management, travel training, curb cuts, because how can you get to a fixed route service if you can't get up on the sidewalk to wait at the bus stop? Volunteer driver programs, of course voucher programs, one-call, one-click centers, etc. And I wanted to mention this because I mentioned sidewalks and curb cuts. So that's not specific only to the 5310 program. In 2011, a decision was made that catchment areas, so anywhere around a public transit stop, you see in the middle, that's an example of a public transit stop. So in a half mile around that transit stop, all FTA funding is eligible for pedestrian infrastructure. And then 3 miles of that transit stop, bicycle infrastructure is eligible. Not just 5310 funds, but all funds. So I just wanted to share that. All right, mobility management. So as Carol mentioned, we have a National Center of Mobility Management, and it's eligible, as you all saw, both under the traditional and other categories. So as you can tell, FTA really encourages it, and we're fans of mobility management. We do not have up here, as you can see, a specific definition of mobility management, because much like the 5310 program itself, we leave that up to the states. So to define what their mobility management will look like, what it will include, but generally mobility management is a practice that captures the mobility needs and develops solutions in specific communities. It links and coordinates the resources of that community, and it connects those resources to people for actual easy access. And so these are just some examples of mobility management and what it can include. Travel training. I already sort of mentioned what it could be. So this just is I think the last bullet is very important. It helps reduce paratransit costs. Technology. So as I mentioned, 5310 funds can support technology in a lot of different ways. So trip planning tools, as is an example in the screen capture on the page there, wayfinding, automatic stop announcements, and then of course one-call, one-click centers that offer an array of resources, including technology resources that help people use public transit and community transportation programs. So I just wanted to quickly give you some examples of what communities around the country are doing with 5310 funds. So under the other category project in Fairfax County, using 5310 funds, they're implementing a Northern Virginia mobility access project. So it's multi-jurisdictional, and it's a mobility management effort to coordinate services to increase transportation options and reduce barriers. And they're using neighborhood groups and training them to provide that travel navigation. So another example, this one is coming from Wyoming, an independent living center. They are using funds for a transportation check program. It's a voucher program to assist people with disabilities to remove barriers to mobility. So they use funding to defray the cost of a ride provided by a friend, coworker, neighbor, or volunteer to help get people where they need to go. Another example out of Portland, Oregon, they are using funding 5310 for the RideWise program. It's a travel training program for older adults and people with disabilities that help people in transition programs and to use mobility devices so they can better utilize public transit. And another one, this one from Wisconsin, from DoorTrans, they're using 5310 funds for a range of mobility management services such as half-price taxi vouchers, shared ride taxi programs, volunteer driver programs, and they also have mobility manager assistance on staff. So local match. Okay, so I mentioned before about the 80-20. So for capital expenses, it's 80% federal funding available, and you have to come to the table with 20% match. For operating, it's 50-50. And then the acquisition of service that I mentioned is sort of an in-between, because acquisition of service can include some operating, but it's at that 80-20 match. So speaking of match, FTA, we allow for local match to come from other federal programs. So this means you can have 100% federally funded Section 5310 program. And then here are some examples of match partners. So these are other federal programs that allow their funds to be used as match. So of course we allow it. We are all for it and encourage it. What you need to check is if those other federal programs allow their funds to be used as match to FTAs. And so here are some examples of other federal programs who have explicitly blessed their funds to be used as match. So for example, in your community, the Aging Services Network, so the Administration for Community Living, they oversee the Older Americans Act. Specifically, Title IIIB, the Supportive Services Funds, can be used as match for 5310. And the link you see on the screen, that first one, includes a frequently asked question from ACL that explicitly says, yes, you can do that. And then the next one is USDA, their Summer Food Service Program. They also have said, yes, our funds can be used as match to FCAs. And then these are links to their newsletters that say that. So here are some other sources of local match that can be used as well. And the last one is transportation development credits. And then now looking at meal program partnerships. I'm sure many of you already know, but I just wanted to mention 5310 programs can and are encouraged to partner with meal programs. So that again, going back to the two examples on the previous slide, includes ACL's Older Americans Act funded meal programs. To find one in your community, go ahead and take a look at the Elder Care Locator. Again, Carol mentioned that earlier, you can find it. And then USDA, they have a locator to find the Summer Meal Service Program location. I wanted to mention too, a community I recently learned about is doing an innovative pilot where they are hosting their summer meal sites. So this is for children who receive free and reduced lunches during the school year. In the summertime, to help ensure they don't go hungry, they have sites across the country where these children come to eat. And Audrey Rowe, the administrator for the Food Nutrition Services, shared with us that a little boy in the 2nd grade was riding his bike along a highway in West Virginia 4 miles each day in the summer to get to this site. So transportation is a big issue. The school bus takes them to school during the school year, but then how do they get to the summer feeding site in the summer? And so in a community in Ohio, they're hosting that site at a senior center. And the bus is already taking the seniors for their Older Americans Act funded congregate meal. So they are having children, because the 5310 program, though targeting older adults and persons with disabilities, because it's still a public transit, if there's an extra seat on that bus, and that child is going the same location, in this case it was, to the senior center, they can ride on that 5310 funded vehicle and hitch a ride. So that's what the community was doing. So the coordinated plan, I mentioned that before. This is really an important document. It's a locally developed coordinated transportation plan that identifies the needs of the individuals with disabilities, seniors, and low-income individuals in that community. It also provides strategies and then prioritizes. Of course, there's going to be a lot of need in many communities, but you need to prioritize what can actually be accomplished with the 5310 funding. And then so projects funded through 5310 have to be in this plan. And so inclusion in the plan takes the form of strategies, activities, and then specific projects that are then funded. So if you're not involved in the coordinated plan in your local community, I encourage you to get involved. Seek it out, find a way to be at the table and to help the transit provider in your community gain the input they need. And then so the coordinated plan, as I mentioned, in the law it says it must be developed and approved through a process that includes participation by these specific groups. So it's important that if you're not already involved to be at the table and to find out how to get involved. Because what's important is in ensuring the meaningful involvement of these people. And so this community-driven exercise, this coordinated planning process, should have a focus on gaining the involvement from these stakeholders, which means that the meetings have to be accessible, there has to be creative outreach, and then promote the responsiveness so that people sitting around the table can feel they can have a say. And so one of the things, I'm sure this is something that everyone on this webinar is already aware of and does well, just ensuring that for that community planning process that there's physical accessibility in the meeting space for that community plan. Not to mention that there's communication access, so you can ensure that those older adults and persons with disabilities that are coming to give input into that community planning process can hear, can communicate, and can be heard. Some interesting crowdsourcing input has been used. So these are web-based tools that can help stakeholders gain input. Now on the next slide is an example. Locally, this is Capital Bike Share, which is actually how I got over to NADTC today. And this is how they use crowdsourced input. So each of those little green pop-ups that has a number, it's a number of comments from community stakeholders saying where they would like additional stations or just community feedback. So this is a web-based crowdsourcing input example. So community partners. So these are examples of community partners that should be reached out to and engaged and should be included. And these are, again, just examples. Additional people are welcome at the table, and includes healthcare facilities, AAAs, as Carol mentioned earlier, Centers for Independent Living, etc. So let me give you another example of a community. This one is an example of an inclusive planning. So in Knoxville, Tennessee, a team developed a meeting in a box. And this was to facilitate multiple opportunities for community input. And project suggestions that were obtained came from a spectrum of a broad spectrum of stakeholders. And the results came about an innovative project where an app is currently in development. Has it been finalized?
Well, I can't tell you for sure. I think so. But
so stay tuned. We'll share more at a later date. Here's another example of a creative solution that's out of Wisconsin, the Wisconsin DOT. They have some great 5310 projects that include promotion of enhancement and facilitation of access to transportation services, support for short-term management of activities to implement coordinated services, support of state and local coordination policy, bodies and councils, and then developing and operating a one-stop transportation call centers. And in addition, here are some additional Wisconsin DOT examples of what they're doing, including mobility management services. They are developing an inventory of available services in different communities across the state, identifying customer needs, developing strategies to meet those needs, coordinating financial and other resources, which we all know the color of money issue. It happens everywhere and is no small feat. And then also developing customer information and trip planning systems. So another example of a Section 5310 project, another great coordination effort, is out of New Hampshire, and this one they're doing a collaborative between 38 communities in southeast New Hampshire. They're utilizing volunteer drivers, providing mobility management services, referral services, and they're using mobile data terminals to coordinate with partner vehicles, and then it lists all of their partners there. So another example, this one from Texas, of a 5310 project, great coordination. They have 16 different agency partners in this small urban area. They are using ride vouchers spread among their agencies. It covers 8 counties. They have free fixed route bus travel training for the target populations, and they have an MOU with the ADRC there, and they have online resources and transportation options available. So another one, again out of Texas, another coordination effort example with 5310 funding. This one is a mobility management project. Services include brokerage of multiple transportation providers to meet the needs of the target population, consumer-directed models that provide vouchers in 12-county area, and then project partners are included there. All right, so one a little bit closer to where we are today, out of Silver Spring, Maryland. This was a creative project I wanted to share where the Columbia Lighthouse for the Blind, using 5310 funding, is piloting a mapping project. And they provide detailed narrative and mapping audio for routes in and out of 7 key metro stations in the District of Columbia area. And this is for people with visual impairments who require a little extra assistance to get safely in and out of the metro. So this one out of New Mexico is a 5310 project example that has a lot of great high impact using technology. So this is a 5310 program. They're using, it's called a Smart Travel Program. It's geared towards persons with intellectual and developmental disabilities. The program provides smartphone technology to assist people to independently travel on public transit. So another project, a 5310 high impact project out of Oregon from Lane Transit. It's a rural volunteer escort service. It's a mental health transportation program as well for those who are not able to access fixed route or paratransit for the reason of a mental disability. And it also includes travel training and travel host program. So let me get to probably what a lot of you came here today to know. How do I apply? So for example, if you are a private nonprofit organization who is interested in applying, first I would suggest click on that apportionment table I mentioned earlier and find out first, is your community rural, small urban, or a large urban area, and how much did your community receive for the full year in 2016? And then because the Section 5310 program does not report into the National Transit Database, or NTD, it's a little tricky in how to find where to go. So the easiest way I can tell you is if your community is under 200,000, it's going to be your State Department of Transportation. So Google your state, your state DOT, along with Section 5310 program. If you're in a large urban area, you're going to do the same thing, except not state DOT. Instead, to find out who your governor has appointed as a designated recipient for your urbanized area, you're going to Google the name of your urbanized area or the name of your community along with the words Section 5310 program. Now let me show you two examples. I just did this yesterday. So I just randomly picked New Mexico. Let's pretend I live in a rural or small urban area in the state of New Mexico. So I Googled New Mexico State Department of Transportation Section 5310 program. And what popped up in that Google search are the two screen captures you see there. The first thing that popped up was the New Mexico State Management Plan. And the other thing was the state 2017 statewide plan. So it was actually very easy. And looking at the next slide, I picked an urbanized area. So I picked Akron, Ohio, only because it was the first area listed on the apportionment table for a large urbanized area. So I Googled it. I Googled Akron, Ohio Section 5310 program. The first thing to pop up was actually the New York State. So I didn't click on that, but the second and third thing that popped up was the Akron, Ohio, their designated recipient webpage that included their PMP, which is their program management plan, which is the requirement of a designated recipient in a large urban area. And then the other thing that popped up that was very interesting was their request for letters of intent currently being accepted for the 5310 program. And that's the second screen capture. And when you scroll down to the second page, it had the point of contact, and it said that the letters were due in July. So if anyone's from Akron, Ohio, you'll want to get on that soon. And lastly, these are just some resources I wanted to share. These include the link to the 5310 webpage at FTA, as well as the 5310 fact sheet, and then the circular. We are reworking the circular to include the FAST Act changes, but right now the current circular is what you should use, and it's up there. And then the National Transit Database glossary. If any of the acronyms I used are foreign, that would be a helpful resource. Here are some non-FTA resources I thought you might find helpful. And then these are very important, our FTA regional offices. These are the important unsung heroes that really do the important work for FTA. They oversee the 5310 programs in the states and local communities for which you live. So I just wanted to share these resources for the FTA regional offices. And then this is my contact information. I welcome you if we don't get your question answered before our webinar ends today. So you have it. Here's my email and phone number. And with that, questions?
Letitia, if you could give instructions for the participants if they have questions to ask over the phone.
Yes, ma'am. And at this time, as a reminder to submit a question, please press star and the number 1 on your telephone keypad. Again, that is star and the number 1 to submit a question or a comment.
And while that queue builds, we have actually received some questions in the chat section. So just for a second while people get in the queue, we'll present these questions. The first one, Danielle, is there a distinction between public and private nonprofit agencies?
Yes. So it's in the law, and it's required that only private nonprofits are eligible for this funding. So if you are a public nonprofit, you're not eligible.
Okay, great. Next question, could a project that provides access that would not meet the requirements for ADA paratransit be eligible? For example, in order to enhance the well-being or provide access to areas with trails and beaches that are not currently served by public transportation?
So I would suggest to get involved in the coordinated transportation planning process, because it really depends on what the project is. Is it serving older adults, persons with disabilities? So I would suggest that that individual contact, again, looking back whether they're an urbanized area or small urban and rural, contact the appropriate individual in their state and get involved in the coordinated planning process. And if it does benefit older adults and persons with disabilities, include it in the coordinated plan. And yes, it could be an eligible 5310 project.
Great. So next question, does the 5310 program prohibit incidental use of vehicles? So for example, are you permitted to carry non-5310 passengers?
Yes. So, but let me caveat that. So, for example, if your bus is a 5310 funded vehicle and you are taking individuals to a job location or to the senior center and there's an available seat on that bus, yes, you can pick up someone who is under the age of 65 or does not have a disability. So that is not an issue. Same with the meal program example I gave. If you're transporting Older Americans Act funded meals to take them to the senior center, as long as it doesn't impede your services for transit, that is not a problem. That is incidental use, but it's not impeding your 5310 funded service, so go forth.
Next question, can you provide examples of fair and equitable ways of allocating Section 5310 funds that are not competitive grants?
You know, I probably could find a state that is doing just that and give you that example, but off the top of my head, I don't have one. So I would say, whoever asked that question, let me do a little research, find a community or that's doing that, and share that with you. It's happening, I can tell you that much.
The question came in from Gil. So Gil, if you want to email us at the NADTC, that might be the best way to get the answer to you. We can coordinate with Danielle. And the email address is contact@nadtc.org. So the next question is, can small MPOs apply for 5310 grants as a recipient?
They're public.
Well, for coordination and planning, so what would their role be that they're applying? I guess what would they be applying for? Would be my question.
Well, it came in on the chat section, but the person that asked this question, you're more than welcome to press *1, and maybe you could provide a little clarifying information over the phone, or if you want to put a little bit of additional information in the chat section, and we'll come back to that.
Oh, I guess as a recipient, I see the question.
Okay.
I thought they meant as a subrecipient. So if the MPO receives Section 5307 funding, so if they're an urbanized transportation provider, the answer is yes. So that was a much easier question than I was thinking it was.
Okay.
So because of the FAST Act, as long as that MPO is a public transit provider in an urbanized area, then yes, they could come in as a recipient because of the FAST Act changes.
My cue there, though, is small MPO. That says they may or may not be.
The easy answer is they'd have to receive 5307 urbanized transportation funding, and because it includes small urban, if they're receiving it in a small urbanized area, the answer is still yes.
Okay, great. So the next question, do you think an adult day program that serves people with disabilities in a small community can apply for the funding? The poverty rate is high in this community and many people do not have vehicles.
Yes. Yes, they would be. And I would say the first thing to do is get involved in the coordinated planning process, have an idea of find out who the person is in their community who handles. Sounds like it's probably a rural or small urban, so I would start with Googling their state DOT. But yes.
Great. So how can we find out which agencies were eligible to receive 5311 and 5307, but not 5310? Is there a way to find that out?
We find out which agencies were eligible to receive, but not before. I would go to your state DOT. Yes, that would be the quickest way to do that. So your state DOT would have that information.
Okay, great. So the next question, if an adult with a disability is the primary caretaker for a child without a disability and needs to take them somewhere, can 5310 be used to pay for their transportation together?
So to answer this question, they could contact their 5310 service provider to get a ride. So, for example, that caregiver has a disability, so therefore they qualify to use a 5310 funded program in their community. So I would start there, and as long as the child is riding with them and there's an open seat, that wouldn't be a problem for that child to go along on the ride that the 5310 appropriate caregiver was receiving, because therefore having a disability qualifies you for the service. And I would go to the elder care locator and start there to find your local service provider. So it's www.eldercare.gov. Type in your zip code, and your Aging Disability Resource Center will pop up. If you call them, they will know who your local human services transportation provider is.
Well, the child may not ride free, because 5310 probably funds the vehicle, or it may fund some of the other costs that the agency has, but there may be a cost for the person, but probably the child can ride along. I mean, that probably isn't an issue.
And I would definitely contact your local transportation program funded with 5310 and talk with them, and they'll probably help you to find the best fit.
Great. Next question, have the 6 communities which will receive grants been identified, and if so, where can they find out?
Okay, this is Carol, and I'll answer that question. No, the grants haven't been released yet. So the exciting part is that there will be an RFP out soon. It will be advertised on our website, www.NADTC.org. If you qualify when you read the RFP to apply, you will have the deadlines will be given there. You will have a certain amount of time to apply for that grant, and then the grants will be given out for a year. And so please look at the website. I would look in July, and there should be something very soon that should be out there that tells you, but they have not been named. They have not been selected. So the RFP will be coming out soon, and if you qualify, you'll have an opportunity to apply.
Great. So the next question is, our service area is both large, urban, and rural. Is it correct that we may apply to both the state DOT and the designated federal urban designated recipient?
It depends on where your service or your project is going to be. So I would say get involved with the coordinated plan and have your, is it a statewide mobility management program? Is it a transit service? Is it travel training on the public transit in the urbanized area? So really the answer to your question depends more on what your idea for your 5310 program is. So I would say contact where you are in your local community, get involved in the coordinated planning process, and take your great ideas to that venue.
Great. Next question. How would local communities apply for 5310 funds if the designated urban agency handling states a competitive selection process previously required under the New Freedom Program is now optional, and therefore there is no competitive grant process?
So that they are able to do that. That's within the law. They have to define, did they say it was a rural area?
It
says urban area.
Oh, there, okay.
So in their program management plan, or their PMP, they have to outline the process for which they are selecting 5310 projects and subrecipients. So it has to be a transparent, open to the public for gaining your input in that process. So if you don't believe it's an equitable or a great process, be at the table. It's required that those 7 groups we mentioned earlier have to have input both in that process and through the coordinated planning process. So I would say get familiar with the process through the PMP in your community and give input. Be at the table. Call and find out when the coordinated plan will be, input will be held, and be there. Give your input.
Great. Next question. Could an organization that does not participate in the development of the local coordinated plan and is not listed in the plan apply for a 5310 project?
Yes. So when we talk about how to apply, you will need to find out in your community who the state DOT is that has the application, or if you're in a large urban area, who the designated recipient is, and then 9 times out of 10, on the website is the application. Sometimes when you Google it, you'll find the application is just closed, so you'll have to wait for the next year to come open. So I would say do a little research, Google that, and find out how to apply in your community. There's a point of contact that's listed for the 5310 program for your state, and I would reach out and you can find that information out. So usually if the application period has already ended, that gives you plenty of time to get involved in the coordinated planning process before the next application period opens.
All right, great. So next question. I'm curious about using 5310 funding for pedestrian infrastructure in urban and rural areas. Do you have any examples of communities that are using 5310 funds for these purposes?
Yes. I want to say, I forget the exact community it was, but a community, there was a transit stop out front of a middle school. I want to say it was North Carolina, but don't quote me until I look it back up. But they put in a sidewalk along the front of that school to the transit stop. They included a bench and also a bus shelter, as well as a curb cut in that area using 5310 funds. And it was, the school was, I believe it was a school, it was an inclusion location for a large number of individuals with disabilities at that school. And so they did use 5310 funding for those infrastructure improvements for pedestrian access to public transit. That's one example off the top of my head.
The next question is very similar. Do you have any examples of funds being used for bike structures, like the one that you mentioned in your presentation?
So I know that not specifically 5310 funds, but FTA funds have been used for bike share infrastructure, not the bikes, but the infrastructure for bike share systems. But specific to 5310, I don't have any examples of bike infrastructure 5310, but again, I could give examples of pedestrian. You know, for example, if you have an older adult who is using public transit and they can't stand for long periods to wait for the bus, they're going to need a bench. They're going to need a sidewalk to safely get to and from that. Sometimes it's also putting in a median so they can rest when it's a long crossing time across a busy street to get to a bus stop. These are all examples that 5310 has been used to fund in the past in terms of pedestrian use to get to and from public transit.
Great. Next question, is it required that an applicant receive capital funding in order to receive other or operating funding?
Is it required that an applicant receive capital funding in order to receive other? No. So to answer this quick, I guess a simpler answer to this is not all capital, so 80-20, is traditional and or other. So there's, for example, mobility management falls into both traditional and other, and it can also, it's 80-20 match. It's considered a capital match, but falls under both other and traditional. So it's really up to the state and how they want to quantify that or how they want to fund it. And for example, mobility management can also have some operational components within it. And it's how the state decides to define their mobility management program. If you look on FTA's website, we have a 4-pager about mobility management and no specific definition. So again, we've left it quite broad, and it's really up to the state and how they decide to define and design their own mobility management program.
I believe you just answered this question as a part of the answer of the last one. Unless there's anything you wanted to add, does it qualify as part of the traditional 53 funds, and can it be counted as part of the 55% floor requirement?
Very easy, yes. Mobility management does fall under capital, and it does fall under traditional, and part of that 55% floor requirement, yes. So it's very helpful for states when they're having trouble meeting that 55% requirement. Mobility management is a great way to fund a 5310 project that falls in that 55% requirement.
Great. Next question, are there guidelines on what must be contained in the Coordinated Transportation Plan document, and how often must the plan be updated?
So there are guidelines. I would refer everyone to the circular, the 5310 circular, which I linked in resources, and just do a quick word search for coordinated plan. And in that document includes some great information about what the coordinated plan should include. Again, it talks about who should be at the table, those 7 distinct groups that should give their input and also approve the plan. So I would refer, Jennifer, to the 5310 circular, which is the guidance and the guidelines around what must be in the plan.
Great. So, and then how often it needs to be updated?
That's a great question. I want to say, you know what, let me double check. Is it every 4 years?
I'm thinking each time that they apply, they have to show what they've done with it. So they can have the same plan, but they have to show what has happened with it. So
my regional colleagues in every FTA region would know this off the back of their hand because they look at these, review them, receive them. But to be honest, I don't want to say a date and be wrong. So I myself am going to go back to the circular and find out what the requirement is because I'm not sure. I don't want to be wrong and give a wrong date. But I will follow up on that.
Great. Again, any of these follow-up questions you can send to contact@NADTC.org. So the next question, can regional surface transportation program funds be used as 5310 match?
So one thing I should say is no DOT funds can be used as match. So other federal funds can be used as match as long as they're non-DOT.
Are there guidelines about how much a state or management agency can charge for administrative fees?
So 10%. 5310 administrative cap is at 10%.
Okay, and I believe you covered this last question in your presentation, but just really quickly, just for clarification, for a large state, I imagine the designated recipient for funds is chosen by the governor, and how do we find out who that is?
So yes, that's correct. The governor of each state selects and submits a letter of who the organization will be for that large urbanized area, or in many states, it's multiple large urbanized areas. And so that letter is on file at the FTA regional office, and so usually they don't change very often, to be honest. So the answer to that is you can Google it, just as we said how to apply. Google your urbanized area, so your community name, and Section 5310 program, and up will pop the website for that organization. That's the easiest way. The other way would be to contact, if you do that search, you can't find them, I welcome you to reach out to me, or you could call the FTA regional office, and they know that, again, like the back of their hand. They're intimately familiar with each state, each urbanized community, and all of the designated recipients, including they have that governor designation letter on file.
Great. Well, that is all of our chat section questions. So thank you so much for your patience for those that are on the phone. Letitia, if you could bring in our first caller, that would be great.
Yes, ma'am. Your first caller is Todd from Idaho.
Yes, hello. I have a question in regards to the contracted service eligibility for the 5310.
Mm-hmm.
And so those contracts are to be structured on a reimbursement per fee basis. And I know that they're traditionally structured for them to be based off of reimbursement per ride. And I guess I'm just curious about opportunities to establish a reimbursement on an hourly basis instead.
So under acquisition of service, that's considered capital, there's multiple ways you could take that. So it's not, I mean, you can do a voucher system. So I would say that the best thing is, let's have a conversation with your regional point of contact in Idaho, and let me take a look at the circular and the guidance under acquisition of service. If you have a specific idea in mind, and this happens often, we'll get calls from a state or an urbanized area. They have an idea for a project that they want to fall under acquisition of service, and we'll just walk through that project and ensure it meets all of the requirements. So Todd, would you feel comfortable doing that?
Yes, that'd be fine. I guess I was just curious if there's just looking for kind of a wealth of resources to see if there's other organizations that are doing that. But
and 9 times out of 10, there is another community that's doing it. So do you want to give an example of the project you have in mind?
Oh, well, sure. So it's essentially where we would be working with local nonprofits to essentially establish a brokerage system where we reimburse them for the services that they are providing. And we are currently reimbursing on a per ride basis. We would look to transition into reimbursing on an hourly rate.
I do not see an issue with that. And I actually pulled to mind another community that's doing something very similar. They put out an RFP through acquisition of service for a shared ride TNC on an hourly basis. So to be honest, I don't see an issue, but let's talk offline. And I want to make sure your regional 5310 point of contact is also involved in the conversation.
Okay.
So my email is danielle.nelson@dot.gov. And then, of course, I'm sure you need it in writing saying this project is eligible from FTA, so let's get you that, as long as we have all the information and can help you with that.
Thank you.
Mm-hmm.
Okay, thank you. And your next question comes from the line of Donald from Hawaii.
Hi, Donald.
Hello.
Hello.
Can you hear me? Hello?
Yeah.
Yeah, I have a question about the 3/4 miles for paratransit services. Does the 5310 help with that situation to expand it more, you said?
Yes, you can use 5310 under the other category to expand paratransit beyond that 3/4 mile requirement, yes.
Okay, so it's possible. Where can I get more information about that? On your website?
Yes, I would go to the 5310 webpage and click on the circular, or just click right on the circular, and it actually has information in the circular about that.
Okay, thank you.
Falls under the other.
Yep, and it falls under the other category, so the former New Freedom programs.
It's for services above and beyond what is required under the ADA.
Mm-hmm.
All right, I appreciate it. Thank you.
Sure.
Okay, thank you. And your next question comes from the line of Elena from Delaware.
Hello.
Hi, Elena.
Hi, how are you? I'm calling from Delaware Transit Corp. We are an organization who's part of the state DOT, and we receive direct recipients from FTA since we offer public transportation services. I was wondering, we have travel trainers here. Now, that's currently something that's the state funded. However, from what I've learned today, it sounds like it could be charged to a 5310 grant application. Now, would that fall under capital or would that fall under operating expenses? It sounds more like operating as the 50-50 match.
So, it traditionally falls under operating, but states have gotten creative and funded a mobility management program that has a travel training component within it.
Okay.
And therefore, it falls under capital and traditional within the 55%. And I have been seeing more and more of that, so that's an option.
Okay, so maybe we would have to rework our state management plan to incorporate a new mobility management plan if we wanted to put the travel training under that.
Yes, and then travel training could be a component, and though it's operational in nature, it's one component that's operational of a larger mobility management component, of mobility management program.
Okay. Now, would that require us to have to negotiate an indirect cost rate because we would be charging travel trainers their actual salary to the grant?
Well, you already have a negotiated indirect cost rate with FTA. So, so that's already established.
I guess what I was trying to say, prior to that, we never charged a travel trainer's salary to the grant. So I wanted to know whether the minimum rate would apply.
You would include that information in the grant for the 5310 program. So you would include that as part of the grant.
Okay. Gotcha. All right. Thank you.
Sure.
Okay, thank you. And your next question comes from the line of Vicki from Michigan.
Hello.
Hello.
I just wanted to share some information for your first phone caller. He was asking about the hourly rate and stuff like that. I just wanted to share that we do a transportation voucher program here. We don't pay hourly, but we do pay like 50 cents per mile, but the volunteer driver hours and time help us draw down our match money, if that helps him at all to answer his question.
Thank you, Vicki. I appreciate that.
Not a problem.
All right, so that was our last phone caller for the moment. We do have another question on the chat section. It says, we operate a transportation service to which social workers from healthcare centers, home health organizations, and hospice contact us to provide transportation for older adults and people with disabilities when no other services are available. We are a very small ministry. Can we apply for 5310 funding from Augusta, Georgia?
If they are a private nonprofit organization, they can. As long as they have so if they're a private nonprofit, they're eligible as a subrecipient. That's the first part. And then they would have to have a program that they'd apply through a grant as a subrecipient for a program that was targeting older adults and persons with disabilities. So it sounds like they already meet that, so yes.
Okay, great. And that concludes all of our questions.
Okay, we have a couple more slides. Great. Okay, first of all, this is Carol again, and I want to thank everyone for all of your questions. I am so pleased with the quality of the questions that were asked, and Danielle, I think you did just an outstanding job of answering them. It is very tough to field questions on the fly, and Danielle had great answers for you. Some of you may have had questions that you weren't quite sure how you should phrase them, or things that you were thinking about, or after the webinar is over, you think of a question that you wish you would have asked. And so we'll be giving you some information in a little bit. You can email Danielle directly, or you can email us at NADTC, and we will be glad to try to get those questions answered for you and get the answers out to you. For those of you who are participating in the Section 5310 course or are interested in participating, those questions can be posted on our forum, and the answers are available to everyone who has participated. So that's another good incentive for those of you who are interested in taking the course. Please take time to fill out an evaluation of today's webinar. It helps us improve our presentations. It's really important to us. Tell us how you like this format. Tell us if you think this is the appropriate amount of time. Tell us the topics that you would like us to cover in the future. Please go to https://www.surveymonkey.com/r/federal perspective eval and send us your evaluation and let us know. It's very short. Let us know what you think of, what you thought of the webinar and any suggestions for improvements. We really appreciate that. That helps us move forward. Please sign up for additional Section 5310 webinars. If you go to our website at www.nadtc.org, you'll be able to see the one that is coming up for next Thursday, which brings out the state perspective. And please check out our online Section 5310 course. It's called Filling Gaps in Mobility for Older Adults and People with Disabilities. By the number of questions that we had today and the number of participants we have, we know that this is a hot topic for all of you and something that you'd like to learn more about. Let me encourage you by telling you that the Section 5310 course is not graded. It is self-paced, so you don't have anyone pushing you to hurry up and get done. You have till September 30th to complete it. You will participate in the webinars just like you did today. You will take a short quiz, which will be 5 to 10 questions long at most. That's true, false, or multiple choice to make sure that you actually did participate in the webinar. You will have forums that you can participate in, and questions like we had today will be answered online, and you can chat with other people. You know, we had Vicki from Michigan who came online, and she helped Todd from Idaho with his question. That's exactly how those forums are scheduled to be. Someone asks a question, and then all kinds of people who do something similar can answer and give you ideas. If someone poses a question and no one has an answer, then we go out of our way to find answers for you. So another reason to look at the course. If you want more contact information, I have both mine and my co-director's information up here. So you can contact either me or Virginia Dyes. Our telephone numbers are there. Our email addresses are there, and again, the website. So on behalf of Easter Seals and N4A, we are funded by the Federal Transit Administration, and we want to thank Danielle Nelson in particular. Danielle, you did just an excellent job of giving people an overview of Section 5310. A person could do days on this topic. But what we really want to do is make sure that ample resources are out there and available to you. Please make sure that you go to our website and check out the other resources that will be available to you. Go back to the PowerPoint that Danielle gave you and look at the resources that she has provided. We will post those. Not only will this PowerPoint be posted, but the resources will be posted in addition so that you can have links that will take you to those various resources. And make sure that you contact us if you have additional questions. So thank you very much for joining us today. Make sure that you are getting involved in your local planning. It's really important, even if you aren't planning to become a grant applicant. It's really important that you have a say in how those funds are being used and what kinds of transit needs are out there. You are many of the people who have the best information that you can pass along to the powers that be in your local area to let them know what the needs are. So make sure that you're taking part in those planning opportunities. Danielle, I'll let you have some of the last words if you want to pass along any other advice to them or let them know about other things that they might need to be aware of.
Just thank you for all that you all do. I can't say enough about this program, even though it's very difficult at times and trying for a small pot of funding in terms of FTA funding has a lot of intricacies. So thank you, keep up the great work, and thanks for all you do.
All right, well, we look forward to having you join us next week on Thursday. We'll be from 2 to 3:30 Eastern Time, and the topic will be Section 5310 from a state perspective. Look forward to the other webinars on 5310 that will be following in August, and you can get those dates off of our website. If you'd like to get directly notified, please go to our website and sign up for our e-alerts, and we'll be glad to get you the information right into your inbox. Thanks for joining us, and we wish you a happy holiday over the weekend. Be safe, everyone.